MedStar Health experts say that they are treating at least 2 cases of cyclosporiasis in our area. It's an intestinal illness caused by a parasite that can linger for weeks and could cause severe symptoms, including diarrhea, vomiting, cramps, bloating, and fatigue. And joining us now is Amanda Joy, physician's assistant and associate medical director for MedStar Health Urgent Care. Amanda, thanks so much for joining us. A lot of people are hearing the word cyclospora or cyclosporiasis for the first time this week. So let's start with the basics here. How is this parasite spreading and how can we protect ourselves?
Well, the good news is it is not contagious. It does not spread person to person. It is spread through contaminated food, largely produce like berries, raspberries, blueberries, blackberries, leafy greens, snow peas and cucumbers, a lot of bagged salad mixes, those sort of things, and some fresh herbs like cilantro, basil, parsley. Those can be good vectors for the parasite.
So I guess my next obvious question is washing it enough? I mean, is cyclospora easy to remove if you wash it thoroughly?
Nothing's 100%, but that will definitely help mitigate the risk. For solid vegetables, we would recommend scrubbing them with a brush. For like softer vegetables or fruits, you would want to make sure you remove any areas where there's bruising to the fruit or vegetable, and then rinse it underwater. Again, that's not 100%, but that can certainly help decrease that risk.
Sure. I know health officials are investigating and trying to pinpoint exactly the source before more people get sick. But if someone is experiencing some of these symptoms we just mentioned, at what point would you recommend someone seeing their doctor and think, this is more than just a stomach bug?
It's hard because norovirus goes around.
Yeah.
We've seen all of that on the cruise ships. But I would give it a good 48 hours, as long as you're able to keep some liquids in and see if you're responding well and getting better. Typically, cyclosporiasis will last much longer than that. It can last 3-4 weeks in duration. But then on the other hand, there are some patients that are infected that never get any symptoms. So it's very hard to differentiate. The average time from when you're exposed to the food and then develop symptoms is somewhere between 2 and 14 days. So on average, about a week after that exposure, where when you have norovirus, it's much quicker.
Right. So my understanding is that there's little known about cyclospora compared with, Salmonella and E. coli. Can you speak more on that and how is this treated? Is this something that, just kind of clears up on its own, or does it require treatment right away?
So let's start with following where it comes from. It's actually not a new virus by any means, or I'm sorry, parasite by any means. There's been outbreaks in the United States. There was a relatively large one in 2013 and one in 2019 associated with different produce. So it's not unusual. And we do see bouts of it each year anyway from people who travel internationally, particularly to more third world countries, Mexico, Costa Rica, those sort of areas that we do see often. If you were to not get treatment at all and you are completely healthy, it will run its course. But the problem is 3 weeks of diarrhea, you could become very dehydrated. And a lot of people have trouble keeping up with the hydration necessary to ride it out. So a lot of people do seek medical treatment, and basically there are antibiotics that will work on this specific parasite to stop its replication. So we typically would use Bactrim for patients that don't have any sulfa allergies, and that would be a treatment of about a week in duration, and most people would recover just fine with that.
A lot of great information. 145 cases reported across 17 states. Amanda, I know you're with me. I hope we can, decrease these cases and find the source of it. Amanda Joy, physician assistant and associate medical director for MedStar Health Urgent Care. Thank you so much.
Thank you.